Prostate cancer in young men 15 to 40. Prostate cancer is a common cancer that primarily affects older men. Recent observations suggest that the disease is also increasing among adolescents and young adults. This has led to concerns about the underlying causes and implications for diagnosis, treatment, and prevention. To investigate this phenomenon, researchers have conducted a systematic analysis, including incidence, mortality, and survival data from different sources and countries. According to the U.S. National Cancer Institute Surveillance, Epidemiology and End Results Program, and the Institute for Health Metrics and Evaluation Global Burden of Disease database, the incidence of prostate cancer has increased in all age groups between 15 and 40 years worldwide. It has been rising steadily at an average rate of 2% per year since 1990. This trend is statistically significant, p less than 0.01, and suggests that the disease is becoming more common and affecting younger men. The reasons for this trend are not fully understood. It may involve multiple factors, such as changes in lifestyle, environmental exposures, infectious agents, genetic predisposition, or medical practices. In the United States, young men 15 to 40 years are more likely than older men to have distant disease at the time of diagnosis. This means that the cancer has already spread beyond the prostate gland. This is a critical factor in determining the prognosis and treatment options, as advanced prostate cancer is generally more difficult to cure or control than localized cancer. Moreover, the survival rates of young men with prostate cancer are lower than those of older men, even after adjusting for stage and other factors. Specifically, the 5-year relative survival rate for men diagnosed between 40 and 80 years is generally between 95% and 100%. Whereas for those aged 15 to 24 years, it is only 30%. For those aged 20 to 29 years, it is 50%, and for those aged 25 to 34 years, it is 80%. These disparities suggest that the biology and behavior of prostate cancer in young men may differ from those in older men, that the optimal management of the disease may require age-specific approaches. The implications of the increasing incidence of prostate cancer among adolescents and young adults are not clear. They may reflect a combination of true changes in the disease burden, changes in diagnostic methods and criteria, or changes in awareness and reporting. Some researchers have argued that the use of PSA screening in older men may have led to overdiagnosis and overtreatment of clinically indolent tumors, that the lack of PSA screening in young men may lead to underdiagnosis and delayed treatment of aggressive tumors. Others have suggested that the rise in obesity, physical inactivity, and other lifestyle factors that are associated with the development of several cancers, which may contribute to the development of prostate cancer in young men as well. Additionally, exposure to infectious agents, such as human papillomavirus, HPV, may play a role in the pathogenesis of some cases of prostate cancer. The evidence is not conclusive. Finally, differences in referral patterns, access to care, and health disparities may affect the likelihood of being diagnosed and treated for prostate cancer amongst young men in different countries and communities. In conclusion, the increasing incidence of prostate cancer among adolescents and young adults is a complex evolving phenomenon that requires further research and attention. The biological, environmental, and social factors that contribute to the development and outcomes of prostate cancer in young men may differ from those in older men. Thus, it may require tailored approaches to prevention, detection, and treatment. Healthcare providers, researchers, policymakers, and patients should collaborate to better understand and address the challenges and opportunities associated with this trend. We hope this helps you. Ellen and Michael Moriarty, 2 RNs.